Yeah,
Yes.
looks good.
Okay. Alrighty. Welcome, everyone. My name is Mahalia Seeley, and I'm PCAR's Saki trainer and project lead. Saki stands for Sexual Assault Kit Initiative. And today, my co-presenter will be Jamie. Please, you
Hi.
can introduce yourself.
Hi, yeah. Hi, everyone. My name is Jamie Long. I am the Sexual Assault Kit Initiative, or SAKI coordinator. I work with the Office of Victim Services under the Pennsylvania Commission on Crime and Delinquency. I'm really excited to be presenting to all of you today.
Yes. And today we'll be talking about Pennsylvania's Sexual Assault Kit Initiative and the kit tracking system. Okay. Jamie, would you just...
Yep. So, just to, and we'll cover this just really briefly. We receive federal funding for this initiative, and this is just a disclaimer, just stating that because we receive federal funding, just our the things that we express are not necessarily the view or opinions of the Department of Justice. So this is just a disclaimer that lays that out.
Thank you.
Mhm.
Okay, so in today's session, like I mentioned before, we'll go through understanding Pennsylvania's Sexual Assault Kit Initiative and the rape kit tracking system, which is called Track Kit. We'll review SATAC, which is the um, sexual. Okay, I'm getting
Assault
brain
Testing and
fog.
Evidence Collection Act. That's
Yes,
okay.
thank you. So SATAC laws and the survivor rights will respond knowing ways that advocates can respond to survivor questions about track kit and their kit status. Will identify some challenges survivors may face during this system, during this system implementation, and just also like re-engagement, and just also touching on, as you all know, as advocates, applying that trauma-informed practice and advocacy when it comes to connecting to survivors and providing support. Okay, so a sexual assault kit, right? Or some people may call it a rape kit, or for short, we can just say a SAC. But during this presentation, we may interchange the words that we'll use, saying, um, saying sexual assault kit or a SAC. So just to get started, a SAC is a collection of forensic evidence gathered after a sexual assault. And as I mentioned before, SATAC, the sexual assault, um, I'm sorry, Babs, can you help me with the name again? It's slipping my mind.
Absolutely. Sexual Assault Testing and Evidence Collection Act. And I did write that out in the chat as well.
Thank you. So nationwide, right, there was at a certain time nationwide about, let's say back in 2015, there was about maybe 300 to 400,000 unsubmitted kits sitting there nationwide. And when we think about it, each kit is an individual. So that's an individual that has no information about their kit. Like I've been through um, this traumatic incident. I went to get a kit filled out, a forensic exam done so I can have this sexual assault kit collected. And then it's just sitting there and I have no idea what's going on. So there was a lot of pushback around that initiative, around that issue. And that's how the Saki Sexual Assault Kit Initiative, that's how it came about. And as Jamie mentioned, the grant funding, it's a federal grant initiative that's happening nationwide where different states can apply for this Saki funding to address the unsubmitted kits in their state, in their regions. And we know when these kits are not tested, right, it results in delayed justice for survivors, missing the opportunity to identify offenders causing these harms, and just, survivors and people just losing trust and trust in the system, and also just feeling like, they're the state agencies who are supposed to be there to protect them and support them aren't. So we're happy that Pennsylvania is taking up this initiative, is doing the work to address these unsubmitted kits, and is doing the work to support survivors. Um, so just to give a little overview on some of the numbers here in Pennsylvania, um, based on data from 2025, there were 3,293 cases of rape reported to law enforcement. And we know not all victims report these crimes to law enforcement. So that number is just a fraction, right? According to data, only 1 in 3 victims actually report their sexual assault to law enforcement. And that's and there are many reasons for that. Like I mentioned, just having a mistrust with law enforcement, not feeling like they'll be believed, again, with all those unsubmitted kits that were just sitting there, victims and survivors just feeling like, what's the point in actually going through with this, reporting this when nothing happens? So based on this number from 2025, we know that that's just a fraction of the people who actually report it. The numbers who don't report, it's much bigger. But based on this number, about 48% of those cases were cleared in 2025. So that just means like no further investigation was being completed on it. And based on data from 2024, there were 233 sexual assault kits still awaiting testing here in our state of Pennsylvania. Okay, so just to give a little history on SATAC, right? The Sexual Assault Testing and Evidence Collection Act. So as I mentioned, back in like 2005, there's a lot of outcry and pushback about all the unsubmitted kits that that were happening nationwide, that's happening here in the state. So prior to 2006, before Act 165, there was no set standard on how the different counties here in Pennsylvania would, collect, test, and store any of these kits. So when this act was established in 2006, that established that foundation and the statewide process for how these rape kits or these sexual assault kits were to be collected, tested, tracked, and communicated about. And with SATAC, it also set minimum standards for how the sacks are designed and collected. Um, the actual kits, the manufacturers that Pennsylvania will use to supply their kits, establishing trainings for personnels on the correct usage of the kits. It also established the approved laboratories who can actually test these kits. And yearly DOH will compile data to, to show all of the untested sacks. So just trying to, form that structure, that accountability. This is when SATAC was introduced in 2006. And just to go over some of the approved labs that came about, it's all of the PSP labs, so the Pennsylvania State Police, their Bureau of Forensic Service regional labs, which are about 6 of them, the Allegheny County Division of Forensic Laboratories, and also the Philadelphia Police Office of Forensic Science. So those are all the approved labs who can actually test any of the kits here in Pennsylvania. And along with SATAC, just giving survivors more choice and control over how they choose to, report their sexual assault or just engage with law enforcement. These anonymous choices were established. So survivors, when they go into They go into the hospital, they have a forensic exam done, and then this kit is collected. Survivors have three options to report their sexual assault anonymously, right? And the three options they have when doing an anonymous report is anonymous A, which is to report and test. So the survivor is going to report the incident, and they are consenting for their kit to be tested and sent to the lab. Option B, the survivor can report the incident, but they do not consent for the kit to be tested or sent to the lab. And then there's option C, where the survivor does not report the incident to law enforcement and does not consent for their kit to be tested. And all these kits, if the survivor is not consenting for it to be tested, the kits will be stored with the law enforcement agency that's associated with that specific county and area. And these options, like I mentioned before, it's just giving survivors, you know, rights, allowing them to feel in control of, you know, an incident that made them feel like, they've lost all control. And just knowing that, there are services out there for them, including like medical accompaniment, and knowing that law enforcement must provide those updates for them if they're seeking and inquiring about it. SATAC also established a time frame for when kits are to be collected and how it should move through the different disciplines. So when a victim goes into the hospital, a kit is completed. Once that kit is completed, the hospital has up to 12 hours. The hospital must notify law enforcement within 12 hours after completing that kit, if law enforcement isn't there already to collect it immediately. Once law enforcement has been notified that a kit is ready for pickup at the hospital, law enforcement then has up to 72 hours to pick up that kit from the hospital. When law enforcement picks up the kit from the hospital, if the kit will be sent to the lab, law enforcement has up to 15 days to send that kit to the lab. If the kit is not being sent to the lab for testing, law enforcement will store the kit. And once the kit gets to the lab has up to 6 months to complete the testing and analysis on that kit. And let's just go back. Let's say for some reason it's the hospital notifies law enforcement within 12 hours. Law enforcement was notified, but it's over 72 hours. And a law enforcement agent did not pick up the kit from the hospital. That hospital can then call DOH at the number on the screen to help coordinate pickup with law enforcement. So SATAC laid the foundation, just really put things in perspective for Pennsylvania State. And a part of that, like I mentioned, was tracking the kits. So then Act 70 of 2022 came about, and this was just a feasibility study by the Pennsylvania State Police. And they just looked at the different kit tracking systems that were being used nationwide to determine what system will work best in Pennsylvania, knowing that we have some very urban areas, some very rural areas, a mix. So this feasibility study was just that, just reviewing the different kit tracking systems to determine what will work best for our state. And ultimately, it was decided upon that TrackIt is the best system that will work for Pennsylvania. So sorry, just reviewing some of the systems they reviewed was the Idaho Sexual Assault Kit Initiative, the Sexual Assault Management System, TrackIt, and the Physical Evidence Rate Kit. So they decided on TrackIt, that TrackIt met all of the stipulations that Pennsylvania needed. So then Act 122 of 2024 came about that made the kit tracking system a reality here in Pennsylvania. So it amended SATAC, right? It's strengthening victims' rights, notification, transparency, allowing survivors. This kit tracking system will allow survivors to confidently, track the status of their kits as it's moving through the different disciplines, like I mentioned, from the hospital to law enforcement to the labs. Um, and this kit tracking system will be managed by PCCD, which is the Pennsylvania Commission on Crime and Delinquency. PCCD will continually apply for federal funding so that this system can be used and will not be a cost to the law enforcement agencies and the hospitals using it. And here I will send it over to my co-host from PCCD, Jamie. You can take over.
Okay, thank you. So as Mahalia mentioned, Act 122 of 2024 enabled PCCD to apply for the National Sexual Assault Kit Initiative federal funding. This initiative was established to help state and local jurisdictions address the backlog of kits that they've had build up, and also to help build capacity to investigate and prosecute cold cases that were tied to these unsubmitted kits. Ultimately, this funding aims to create a coordinated community response that ensures just resolution of these cases through a trauma-informed and survivor-centered approach. So funding provided through SAKI is used to identify and test previously unsubmitted or unprocessed kits, some of which may have remained untested for decades. DNA results that are yielded from this testing are then used to reopen and prosecute cold cases, which also helps oftentimes link serial offenders to multiple crimes that stem from these backlogged kits. Projects are required to develop trauma-informed practices for notifying survivors about case developments, and long-term policies and protocols should be developed that improve collaboration among law enforcement, labs, prosecutors, SANEs, victim advocates, all to try and prevent a future backlog. So ultimately, this funding is transforming how communities respond to sexual assault by delivering long-awaited justice to survivors, identifying repeat offenders, enhancing public safety, and building trust in the criminal justice system. Next. So Pennsylvania applied for SAKI funding in August of 2024, which is around the same time that the legislation 122 was passed. This application was submitted in coordination with PCAR, Pennsylvania State Police, and the Pennsylvania Department of Health. And we were awarded $2.5 million over the course of 3 years for this grant. There are numerous purpose areas that entities can apply for. We focused on Purpose Area 1, which is a comprehensive approach to addressing unsubmitted kits. This includes all of the goals that were in the previous slide, including doing an inventory of all unsubmitted kits, and then all of the downstream activities associated with that inventory, such as getting kits tested, the investigation and prosecution of cold cases. And then, of course, any of the activities that are related to the implementation of sustainable practices to try and prevent a future backlog. So our project goals are to designate a SAKI coordinator, which is me. This is actually a grant requirement. So recognizing that such a huge project needs a sole coordinator person to kind of instruct and lead. This is why it's a grant requirement. So I started in this position. We're cutting very close to a year ago. And one of our other goals, again, this is another grant requirement, is to create a multidisciplinary team. This team convened in spring of last year, shortly after we were awarded the grant. Our MDT is made up of individuals from PCAR, the Department of Health, Pennsylvania State Police, local law enforcement, prosecutors, victim advocates. Oh my gosh, and you name them, they're probably on there. The Hospital and Health System Association of Pennsylvania. We have representatives from all 3 of the crime labs across Pennsylvania as well. So it's a group of close to 30 people that have been meeting about every month and a half right now as we get ready to launch the tracking system. The other one of our other goals is to inventory all of the sexual assault kits. Like I said, this is another grant-related activity. All of the law enforcement agencies across Pennsylvania have been asked to inventory all of the kits that are currently in their possession. This is going to be a pretty lengthy process, and we don't anticipate this inventory being completed until January of 2028. We notified all of the law enforcement agencies in August of last year, and we've only thus far inventoried kits from Pennsylvania State Police and the Philadelphia Police Department. So we are just branching out into the rest of the state now, focusing on some of the bigger counties and then hitting some of the lower class, like class 6, 7, 8 counties towards the end of the inventory. Um, with that inventory being conducted, the Pennsylvania State Lab is Pennsylvania State Police Lab. There we go. Is helping us to identify kits that have never been submitted for testing, and also kits that have been partially tested. And partially tested kits are kits that have only had serology only or identification of bodily fluids, or have never received CODIS eligible DNA technology. If you're not familiar with CODIS, it is a national database where DNA profiles are uploaded that are obtained through forensic testing to help the identification of offenders. So, with these kits being tested, as we identify some of these unsubmitted and partially tested kits that should be tested, we are anticipating that there will be investigations and cold cases that are reopened and taken another look at, and hopefully try to resolve some of these. And this is going to impact all of you as advocates, and I will touch about that here in a second. But also to our last big goal that I really want to at least mention, and we'll go in a little bit more in depth here soon, is about the implementation of a sexual assault kit tracking system. So this is where most of the grant funds are going to, supporting the configuration, implementation, and supporting the first few years of us using the tracking system. So go ahead. So I mentioned about the possibility of cold cases being reopened, and why is that important for you as an advocate? Is because you are going to have survivors that are going to be possibly re-engaging with the criminal justice system, possibly even years later, and also with limited understanding of the criminal justice process itself. So part of this re-engagement may lead to resurfacing trauma, continued mistrust in the criminal justice system, and even possibly feelings of powerlessness and hopelessness. So, being able to provide trauma-informed communication to these individuals is going to be extremely important as they re-engage. Being able to explain how the criminal justice system works to them, being able to get information to them about their case, being able to provide accompaniment, anything that you can do to build rapport with these survivors is going to be really helpful in this process. Um, you're all advocates, and I know that you've all received trauma-informed training. So I cannot emphasize enough how important it is to utilize some of those skills that I'm sure you all are experts at, to be able to provide support for survivors. Some of the other things that come to mind are being able to provide them with choices, giving them autonomy, letting them engage in a level that they are comfortable with, and trying to continue to provide a safe and supportive environment for them if they do choose to re-engage with their criminal justice system related to their case. Go ahead next. Before I jump into the tracking system, I wanted to just highlight a couple other projects that have stemmed from this initiative. Talking about these cold cases, we are in the process of working with the Attorney General's office, as well as OVA, law enforcement, the PSP, Pennsylvania State Police, and PCAR to develop a victim notification protocol for cold cases. SATEC actually requires the AG's office to have a protocol for all law enforcement agencies to follow, regularly for any sexual assault case. But SACI also wants us to take a focus on cold cases because of the inventory process. So we are working on developing this protocol. We are planning on taking a notify all approach, meaning that as soon as a kit is finished getting tested, we would like to attempt to get in contact with that survivor to let them know that that something has happened with their sexual assault kit. And if by their choice they would like to have that information, have a process for them to receive that information. This process will involve both victim advocates and law enforcement. So this is a joint procedure, or joint protocol, trying to be as trauma informed with this as possible. So more information about this protocol will be provided as it is finalized. Next. One of the other things that we've learned as part of this process is that that not every sexual assault kit is being submitted for testing. So the way that SATAC currently reads, there is law enforcement discretion as to whether or not a kit should get submitted for testing. So we have put together a resource encouraging law enforcement agencies to submit every kit that they've received. There's also currently legislation that has been introduced and has passed the state Senate and is currently in the House. It's State Bill 1212 that amends SATAC and encourages law enforcement to, or would require, not encourages, would require law enforcement to submit every kit for testing. I think between PCAR and just everyone who has been involved with this project, we recognize that if a survivor is going to go through a 4-hour, 6-hour, 8-hour exam, and they want their kit tested and they consent to having it tested, it should get tested. It's a fair and just practice, and I think we all recognize that. Okay, so now the tracking system. As Mahalia said, there's a number of requirements that Act 122 has laid out that the tracking system should have. So through our analysis of all of the commercial off-the-shelf systems, tracking systems that are available, TrackKit was the only one that met all of the requirements laid out by Act 122. TrackKit is probably one of the most widely used tracking system across the nation. There are 17 states that are currently live or about to be live with TrackKit, Pennsylvania just being one of them. So this map shows the 17 states that are currently using TrackKit. Next. A little bit about TrackKit. It is a web-based, cloud-based software. So as long as you have internet access, a survivor would be able, or whoever, law enforcement, medical facilities, laboratory users can access the website and the system. It ultimately tracks kits from the time that it's collected at the hospital all the way until its destruction at the law enforcement agency. There is a survivor portal that will allow survivors to confidentially view the location and status of their kit, and they'll also be able to opt in for notifications. The system also has 24/7 help desk availability, and that's not just for users, but that's survivors as well. And there will be support for multiple languages on the survivor portal. This is still a work in progress. We plan on having it translated into, I think it's about 7 or 8 different languages. The languages are congruent with the languages that we have a lot of our victims' compensation materials translated into. So it'll be the same languages. The one thing that we've been trying to emphasize with especially law enforcement agencies and medical facilities is that everything that they're currently doing related to sexual assault cases, whether it's the exams, evidence handling, whatever, it does not change with the tracking system. Instead, this is just an addition to. And we're not asking them to change what they're doing. We're just asking them to take one extra step in tracking the sexual assault kit. Next. So hospitals, law enforcement agencies, the labs will all have access to the system. So just to kind of explain how the kit will move through the system, the hospital will collect the kit. They'll log into the system, enter some basic information such as the date of the exam, as well as who collected the kit and the law enforcement agency who will be taking custody of the kit. During that exam, and I'll talk a little bit about this too, they'll be providing the survivor with some information on how to access the survivor portal. Once law enforcement picks up the kit, they will access the system, provide in, again, some basic information, including the date that they picked up the kit and the officer who picked it up. If the kit is going to get tested, I should say if there is no consent for testing, it's automatically going to go into storage. There's nothing else that happens at this time unless consent is provided. If the kit has been consented for testing and it is going to go to the lab, law enforcement will deliver the kit to the lab. The laboratory will also then access the system, enter some basic information, including the date that they received the kit. They'll do their analysis, and when their analysis is complete, they'll go in and mark that as complete on the date that the testing was finished, and mark that the kit is ready for law enforcement to pick up the kit. Then law enforcement will again pick up the kit from the lab, access the system, enter some information about picking up the kit, and then it'll be kept in storage until the kit is, if and when it is eligible to be destroyed. Next. So about the survivor portal. So during the time of the exam, survivors will be provided with a business-sized card or business card-sized card that has their kit barcode number as well as a temporary password, including the link to the survivor portal and a QR code that will link them to the portal. This card will have all that information on there. Through the survivor portal, they can track their kit's progress as it moves from medical facility to law enforcement and back to the lab. There's also going to be survivor resources listed there. All of the rape crisis centers will have information. Their information will be included in the resources section of the tracking system. They will also be able to find the contact information for the medical facility and law enforcement agency that's associated to their kit. They can also opt in, as I mentioned earlier, for notifications about anytime the status of their kit changes. So they can receive email or text notifications. And they can sign up for those. Anytime something happens with their kit, they'll receive a text and or email notification. There's also a quick exit feature that allows them to leave the site quickly if need be. And if I'm able, I'd like to show the survivor portal. I think I need to, you might have to grant me. Oh, there we go. Share. So here's the survivor portal. As you can see, it's pretty nondescript. There's nothing on here that says it's pertaining to a sexual assault kit. The survivor will log in with their barcode. All of the barcodes will either start with PA for Pennsylvania or PA for PAPC for Pennsylvania Policy Center, which is PCCD's office. You'll see these a lot initially as we prepare to implement TrackKit because the kits will not be barcoded until much later, probably sometime early to mid next year. So you'll see PAPC quite a bit. So they'll put in their barcode and then they'll go ahead and put in their password. There's an option for them if they forgot their password and also contact support. There's also information on how to clear their browser history and cache. I'm going to go ahead and sign in. Just kidding. Let me try this again. I think I typed in the wrong password. There we go. What'll happen the first time a survivor logs in, because their password that was provided at the exam is a temporary one, the system will prompt them to change their password. I've already done this with this kit, so you're not seeing this. But the other thing it'll prompt them to do is set security questions. We really want survivors to set security questions so that way if they do forget their password, they are able to reset the password on their own. If they forget their password and or their barcode number, they can contact law enforcement, law enforcement agency associated with their kit, or the medical facility, or they can contact you and you can help them with that process. A lot of the language you'll see here in a moment will encourages survivors to reach out to rape crisis centers first. To assist with that process. But if they want to contact the medical facility or law enforcement agency directly, they can do so as well. But if they set the security questions, they can reset the passwords on their own. So there's some basic information here at the top, including how to find their local rape crisis center. And then also the timeline that Mahalia went through that's outlined by SATEC. As you scroll down is the kit time. What I should talk about here is whether or not there was consent for forensic testing. So it'll say yes if the survivor did consent, or no if they did not consent. And if they want to change consent for any reason, they can contact their local rape crisis center or the law enforcement agency. Below that is the timeline. So this is a kit that has been collected at the hospital, has gone to the law enforcement agency, was sent to the lab for testing, and then went back to the law enforcement agency for storage. So the most recent event will appear at the top of the timeline. So currently, tracking for the kit is complete and it's being stored at the law enforcement agency. But as you scroll down, you can see the other events as the kit has moved through the different systems. Down here is the resources section that I was talking about. So they can filter, it should automatically filter by state, but they can also filter by county. So I do have a Philadelphia resource here that if I select Philadelphia, they can find all of the resources that are tied to their county. Here's where they'll be able to find their contacts. So you see the contact information for the medical facility, and then the contact information for the police department. And again, clearing browser history and cache, and this will change depending on the browser the survivor is using. So I'm currently using Edge, so I have instructions for Edge, but if they're using Chrome, they'll see that. If they're using Firefox, they'll see that. Up here in the right is that quick exit feature. Down here in the bottom is the chat feature. And then let me close that back out. And then just opt in for notifications. That's done here with this little person icon in the top right by clicking user profile. Here they can change their password. Here's where they can set the security questions. And then this last tab is update notifications. So this is where they would opt in for notifications. They fill out their email if they want email notifications, cell phone number if they want text notifications. They can select an ideal time that they wish to receive notifications and whether or not they want the link to the survivor portal and their barcode number and those included in those notifications as well. They can choose to receive notifications anytime that the status of their kit has changed and whether or whether their password has been changed. So that is the survivor portal. I'm going to stop sharing. I'm going to have Mahalia pull the PowerPoint back up. So ultimately, the goals for the tracking system are to be able to provide survivors with clear, accessible information. We want this process to be transparent, and we also want to increase the level of accountability for all of the systems regarding sexual assault kits. We want to make sure that survivors are provided with timely updates about their kit and what some of the next steps are and what they can expect as part of the process. Trying to reduce some uncertainty with consistent communication. So Chat is just a small piece of that. You as advocates play a huge role in providing consistent communication, especially regarding their case. This will hopefully be able to get systems to begin operating out of silos and see a more coordinated approach to sexual assault investigations amongst you as advocates, the law enforcement agencies, and prosecutors, as well as any other entity that may be involved. And this is just simply a very trauma-informed practice that has been adopted by almost every state so far. There's maybe, I think, about 9 more after we go live with TrackKit that still need to go live with the tracking system. So this just it reinforces survivor choice, where they can again engage with the criminal justice process at a level that they feel comfortable with. Go ahead. So a little bit about what implementation is going to look like for the tracking system. So we are about to begin the pilot phase for the system. We've selected Erie, Lancaster, and York counties as the counties in which we are going to pilot the system in. We didn't want to go too big because it could have been really overwhelming. We also didn't want to go too small because we obviously want kits to get entered into the system and to ensure that the process is works for real-time users. So We tried to pick some moderate counties where there's, at least an urban area, but then there's also some rural areas, trying to account for any issue that we may encounter when we actually go to roll out the system statewide. So this pilot begins August 3rd. You may have received some communication from either PCAR or our office, or maybe if you've been in attendance at some start or stop meetings, maybe word has been spread during some of those meetings as well. Um, but we notified at least the pilot counties about this at the end of April, beginning of May. They need to provide information to us about their site, including address and phone number, as well as the users. And we are still a week and a half away and still trying to get some information from law enforcement agencies, but fingers crossed we'll be ready by August 3rd. We held a kickoff meeting on June 23rd with all of the pilot sites. Again, some of you may have been a part of that if you're from Erie, York, Lancaster, York counties, to go over some of the expectations for the pilot. Training is currently underway for all of the pilot sites. We had ones with the lab yesterday, and there was one provided to medical facility users today, and then law enforcement will be tomorrow. Um, and then there's also a couple other sessions next week. Like I say, we go live with the system in these three counties August 3rd, and we will be holding check-in meetings about every 3 weeks with all of the pilot sites to get some feedback, just kind of get a pulse for how things are going. If there's been any issues that they've run into as they've begun using the system, trying to learn what has worked, what hasn't worked, so we can better prepare for statewide rollout. Next. So we anticipate rolling out the system to the rest of the counties in November. And then be fully implemented by the last full week of I should say the last full week before Christmas. So we will be up and running by the end of the year. We are going to roll this out in regions, so that way, again, we're just not overwhelmed with requests for assistance. Just recognizing that we are quite a large state with over 1,100 law enforcement agencies and nearly 200 medical facilities. So we're trying to balance this out as possible and make sure that we can provide the support to users to the best of our ability. So as each region rolls out, there's going to be one per week. We're going to start with Allegheny County first. Then we're going to move for week 2 over to Philadelphia and their surrounding counties there in purple. And then we will go from blue, green, yellow, orange, east to west across the state then. We had just sent out and are in the process of still sending out some information to all of the pilot sites in these counties, or not pilot sites, the rest of the counties throughout the state. Law enforcement agencies were just notified on Monday. Medical facilities are in the process of being notified, and I know PCAR is in the process of writing up some information to provide to advocates. If you are a systems-based advocate, so you work out of the DA's office or juvenile probation, I believe I see some people from JPO offices here, you'll receive some communication from our office. We will be training these individuals in October and November. And we'll also be holding another advocate training in October as well to coincide with this training for all of the users. Okay, next. Okay, so what are your responsibilities on all of this as a victim advocate? So unfortunately, you will not have access to the track kit system. But you still serve as a primary source of information how the system works. So that's why I at least wanted to give a brief overview of how to use the survivor portal. I've been talking to some of the victim advocates that serve on our MDT, and we're hoping to put together some like a reference guide, training materials, along with PCAR's help that we can then provide to all of you. That way, if you get questions from survivors on how to do certain things or what certain things mean in the survivor portal, you'll be equipped to provide them with some of that information. But ultimately, we want you to understand how a kit moves between systems. How it moves from the medical facility to law enforcement, how it gets to law enforcement to the lab, how it gets back to the law enforcement agency and their storage protocols. Of course, we want to make sure that you're able to explain track kit to survivors. Like I said, we'll provide some information, some additional information to you that you will be able to answer some of their questions. Of course, we want you to be able to help survivors understand their rights and options, just even outside of track it, but just how their cases are handled, the investigation process, the criminal justice process, whether you're a systems-based advocate or a community-based advocate. It will have some kind of contact with the survivor in some way. And, we're not asking you to do a whole lot out of what you normally do on an everyday basis and just simply provide emotional support and advocacy. Um, we also, again, just want to reiterate providing trauma-informed communication with system partners, trying to develop relationships between medical facilities, law enforcement agencies. The one thing that I really encourage you all as advocates is if you don't already have a well-established relationship with the medical facilities in your area, I would really recommend doing that and try to work on getting those strengthened. Because you may be able to establish like an MOU where anytime that they collect a sexual assault kit, they can provide you already immediately with the barcode and temporary password that you will be able to have that. And this may be information that could even be included in the anonymous reporting form if a survivor does report anonymously or has their kit collected anonymously. So those relationships are going to be really important and vital as we implement TrackKit. So, I mean, Mahalia, I just realized you were supposed to cover that one.
It's okay. You got it. You did
I
a
was
perfect job.
I was on a roll, but I'm going to go ahead and turn it back to you.
I'll just add too, like Jamie mentioned at the beginning, this is a very collaborative process. PCCD is heading this track kit system, but again, many disciplines are involved with shaping it and making sure that that it can really work for our state here in Pennsylvania. So I would say to you, to all of you advocates as well, if you feel like your organization may need like a more intimate one-on-one, let's say, okay, my organization, we just want to like talk through this for a bit, feel free to reach out. I Since you all registered for the webinar, you should all have my email address. Feel free to reach out to me if your organization would like to do, like a smaller just info session or just asking questions, Jamie and I, as long as, our schedules can accommodate, we are happy to accommodate any questions or smaller or just like more intimate meetings organizations would like to have. Um, and also to resource creation. If you feel like there's a need, I know we're in the works. Jamie mentioned we're creating different resources. Feel free to, share ideas with us. Send an email to me. Let me know, like, hey, I think, this would be a great resource for centers or maybe for survivors to understand the system. Share that with us because we want to make sure that everyone who's interacting with the system or you as advocates, even though you're not actually, you don't actually have a portal and will sign into the system, but you should know as much as possible about it so you can support survivors. So share ideas, reach out to us because it really is a collaborative process to make sure everything is working smoothly. Um, And again, I'm sure you guys all have this information. I know recently I sent out an email to all the rape crisis centers with resources, some one pages that we created. So you have those physical materials. Again, other resources you may need, don't hesitate to reach out to us. Um, right? And that's just touching on why this work matters, right? It matters for survivors, right? Survivors are at the center of this because we want to restore that, like dignity and choice and transparency, right? So they know it's like, okay, my kit is with the hospital, it's with law enforcement. Like knowing like which law enforcement agency, like I have a contact information that I can actually reach out to. So just providing that transparency and just affirming to them that their experience matters, right? Like this was a traumatic incident that happens, knowing that they're believed, and people are working to provide justice. And for communities, right, we can hold offenders accountable. We all want safer communities, right? We all want to improve public safety. And just, with this, especially with law enforcement, right, demonstrating that commitment to justice and equity. And for the systems, right, it's just really creating that accountability and transparency again. That's the biggest thing, right? Not having survivors, especially feeling like, okay, now I don't know. I don't know who to reach out to. I don't know what's happening. At least this is giving them, right, an insight and, more power and control over their experience and their choices. Um, and really like shifting the culture towards a more trauma-informed, survivor-centered practice. And these are some additional resources. I'm sure many of you have this information already. And the backlog, that's a great site just to see like different states, the progress different states are making. That Sexual Assault Kit Initiative TTA website, that's another site where you can see, all the states and counties who have received grant funding to address this sexual assault kit initiative. So many great resources.